Hello, Manny.
Hello.
I'm a student nurse. My name's Richard. Can you give me a spot for your patient?
Sure thing. It's an 80-year female. Her name is Marta Yarn.
Okay.
She weighs 175 pounds. Is 5'5". She's a full coat. She came with pain of 6, scale 0 to 10. She's has no known allergies. She has a non-healing sacral ulcer on stage 3 full thickness, tissue loss, measuring 4 centimeters by 4 centimeters wide and 1 centimeters depth. She's on vital signs of Q4 hours, and she's up with assistance and a walker. She has medications ordered. We're going to be giving her some fluids, and she has gentamicin as well. She has a history of being dehydration and pneumonia. Last admission was 6 months ago. She complains of dry, scaly skin, and the breakdown started 6 months ago on her pressure ulcer. Hard of hearing. And she has nocturia. She complains of nocturia as well. She's a non-smoker. She has a history of pneumonia, like I was said, and lower back pain. And we consulted Wound Care. She has a regular diet, but she's going to be MPO after midnight. Her BMI is 29.1, which is considered high, and she reports decreasing appetite. She's a gravid 4, term 3, preterm 0, and abortion 1, with 2 living children. And her albumin is 3.2 in the lower end. She has a right dorsal metacarpal 18 gauge IB. And her vital signs, heart rate was 88, O2 stat 92, and blood pressure is as high as 144/90. And that's it. And a question for me?
Yeah. Why specifically is this client receiving this medication?
Well, the client has infection. We're waiting on results for the culture, and also the white blood count is high.
What action does this medication have on the body?
This medication inhibits protein synthesis on the bacteria.
Okay. When should you question administering this medication?
Gentamicin should be questioned with hypersensitivity, which would be allergic reactions to the medication.
Does this medication have a therapeutic serum level?
Does not, but we can check for BUN and creatinine, specific gravity, and the therapeutic level in the blood for gentamicin should be 4 to 6 milliequivalents.
Which vital signs must be monitored?
Well, in this case, we're monitoring for infection, so you should monitor temperature and blood pressure mostly, but heart rate as well.
Which physiological parameters should be monitored when this medication is being administered?
Well, like I said earlier, you can monitor for vital signs and signs of, with this medication, with signs of allergies and anaphylactic shock.
Okay. What interventions must be taught to the client to ensure the medication is being administered safely in the hospital setting?
Well, always as a client, once the medication is being administered, always check her own IB and make sure it's swollen or feels warm to the touch, and that she drinks a lot of fluids with this medication.
What interventions must be taught for taking the medication safely at home?
I would say the same interventions. Make sure with this medication we take a lot of fluids with it.
Okay. What are the side effects and potential adverse reactions?
Side effects of the medication, for the most part, is vertigo and muscle paralysis.
How will you know this medication is effective?
I will know this medication is effective when the patient starts showing signs of getting better and infection is succeeding, and her white blood count starts diminishing.
Okay. No more questions.
Okay, now we're going to go into the room. Knock, knock. Hello. First thing, wash your hands. Start simulation. Okay, so I'm gonna go to her. The first thing we do is make sure. Can you tell me your name, last name, and
Marta Yarn,
okay,
and,
you got the right patient.
and I'm 80 years old.
Okay, thank you. Make sure we had the right patient. Now I want to check the bracelet myself. Alright, so now she's a full coat. She has no allergies, so I check the bracelet. No allergies. Do you have any allergies?
No.
Okay, so patient confirms that she has no allergies. And then we go into the medication area. So what we're giving to this client today is we're giving IV fluids, normal saline, for to maintain homeostasis in the body, and we're gonna give her antibiotic as well, which when gentamicin you always want to give a lot of fluids
Okay.
to make sure the patient takes it well. So we're giving sodium chloride 0.9% at a rate of 125 milliliters per hour. So we go get the medication, and we compare, make sure it's the right medication, sodium chloride, and then we check the expiration date. Yes, and make sure it is the right dose.
Okay.
And then we'll make sure it's the right route. And in this case, since I'm gonna give two medications, we always call pharmacy to make sure there's no contraindications and the medications are compatible. In this case, they are. So the first thing I'm gonna do is I put gloves on, which I forgot. And then I'm gonna have to check the medication one more time.
Okay.
Okay. And I get my IV tubing. And make sure the bag is has no punctures, and make sure it's up to date. Compare one more time with the MR. Respiration day. I do the same thing for the tubing. Tubing is good. Okay. So now this side over here is always sterile, so you have to be careful. Be careful not to contaminate.
So,
Okay, and you always have to make sure the tubing is clamped when you initially put it in.
okay.
Now we check the patient's. Can you tell me your last name, date of birth again?
Marta Yarn,
Okay.
and I'm 80 years old.
Okay. We do that one more time. Make sure we get the right medication, the right patient, and now I'm going to go ahead and flush the line. Also, when I'm doing this, you want to assess the line, make sure there's no sign of redness or any kind of indication you might want to, change the line at a time. So you flush the line. You always clean the line with 15 seconds with alcohol prep. You flush the line. Take the clamp off, and then you pull back a little bit, make sure it's blood return, and then you just flush it completely. And at this time, I have I'm gonna prime the tubing. Make sure there's no air bubbles. You always have to make sure you have 2/3 fill.
Okay.
Okay, when you prime it, you make sure you prime the tubing. At the same time, you're gonna take an MR to log in the medication. Let me make sure I prime the tubing correctly first. Okay. Okay, this tubing is not very good. Been sitting in the corner for a while. Okay, here we go. Now we prime the tubing. Make sure there's no bubbles. You always want to check for bubbles over here in this these areas. Make sure there's no bubbles.
Okay.
Line. Okay.
Yep, I just want to make
At
sure
this
I
point,
get my IV
you
flush.
take
Okay. And now we're gonna go ahead and
flush
get back
out.
in business. Okay. Knock knock. Hello. All right, Ms. Marta, we are here with your meds. We are back. Can you just verify your name and birthday?
Marta Yarn,
There we are.
80 years
And
old.
now I'm
And how about allergies?
gonna put the medication in the computer.
Any allergies?
All right. Sorry.
So if you
I
can read
keep
that
asking
number
you
for me.
that question. All right.
594
4.
0905 652.
That's my patient armband.
2. Thank you. And now I'm gonna read the barcode. It's gonna be.
The gentamicin, that is
Just take it off a minute so I can read it.
good. That is as ordered. And the sodium chloride. Sodium chloride. 0.9% with potassium chloride. Perfect. Go ahead and check the IV site and flush her lungs.
Okay, so now we get a green light. Alright, now we're gonna go ahead and put the medications in the pixels and Lara's pump.
Push a little bit.
Okay. You turn the Lara's pump on. Okay, is it a new patient? Yes, it is. Is America's Med-Surg floor? Yes, it is. Confirm. Now channel select. And we choose Garrel IV fluids.
And then this goes on to the main line.
And it's 0.9% normal saline. Is this correct? Yes, it is. And then we're gonna put it at a rate of 125. 125.
And then, so one more time.
Okay. It's gonna be 125.
Can you tell me your last name
We'll
again?
put it at rate of 125.
And when's your birthday?
And we put a volume to be infused is 500 milliliters. We put it at 450.
And this one, I'm gonna have you
Okay.
read the number on
And then we press start.
594.
Now this infusion is it's gonna be infusing 125 milliliters per hour, and in order to get we got on now everything's going. We have to make sure it's on clamp.
D 992 648 DD 5.
Okay, and we get the green light. Now this is a normal saline is mixed with potassium,
Okay.
as it says it over here,
All right.
and it's going 125 milliliters per hour.
Mm-hmm.
And we already identified the patient. We make sure the pharmacy was okay to be given, and it's flowing through. Okay. So now we go ahead and save, and I'm gonna do my. The side was it is diabetes on the right.
Now so we can get the other med going.
Let me just do quick documentation over here. Today's day is March 27.
All right. And then we're gonna go ahead and give the sodium chloride. Okay. And again, if you could give me the armband, it is
594-090-5652.
All right. And if you could read me that barcode.
It is D91B 5AA
Okay.
83A 207E.
Save.
Okay. And again, we're gonna show the green light.
issue with the computer. Sorry about that.
Hopefully they won't still be on her by then.
Okay.
Okay, here we go. Alright, so it's being
Side effect.
documented. Diabetes is looking good. There's no inflammation. The fluids, normal saline, are running right through 125.
Okay.
Now we're gonna go ahead and look and get the medication, the gentamicin to be administered. Now over here, we'll make sure we have the right medication. It's gonna be infusing a rate of 80 milligrams per 100 milliliters.
Okay.
We have to make sure we get the right medication, the right time, the right patient, which we do. It's in the room, and the expiration date. So we're gonna be infusing this at under 80 milligrams, right, or 80 milligrams. So now we go make sure, and we're gonna prime the line.
Right in, okay? Alright.
Alright, I have a couple questions for you.
Alright.
Are there any pertinent pieces of
Okay,
information
this is
that
always
you
gonna be
need
sterile.
before administering the client this medication?
Okay, and now what I'm gonna do is I'm gonna do backflow in order to prime the line doing backflow.
Did the
Okay,
information
so
affect your decision to
before doing that, before hanging everything out, you always want to make sure you get the right patient. So you ask the patient's name again and date of birth.
Marta Yarn, 80 years old.
Okay, we're gonna be giving you a gentamicin infusion, IV.
Did this information
So you
affect
clean
how
the
you
port.
actually pay for the medication?
15 seconds. Clean, clean, clean.
Well, thank
Then
you.
insert.
Sure. Alright. I just wanted to be
Okay. And now you wanna open the. You wanna clamp this clamp right here so you can get some backflow and prime the line. You always put it lower than the.
Yeah. The 5-drop rule.
Okay.
They get you really bad now on the floor. If they find out there's a slip in medication, they make you follow like 30 nurses.
Oh wow.
Okay. There you go. The air's coming out.
Okay.
It's good. Now you clamp it one more time. Okay. Now we're gonna switch it. We're gonna switch these ones now because you want the fluids lower than the medication to be administered. Make sure it's the right medication. Now we have to put this into a Laris pump. First, we're gonna open it up in the MR records. And can you give me the patient's ID one more time?
594 0905 652.
Okay. Make sure I put the medication code. It's gonna be D9DD015 11 6E7 3B. Okay, showing green. At this time, showing green. There you go. At this time, I'm gonna channel select secondary. I'm gonna look for the medications, gentamicin, right here, and once daily, Q8 to 4 hours, gentamicin. Okay, and the rate is gonna be infused is gonna be 80, and the doses over here is for 80 times 100. Okay. Yes. Okay, drug amount is we have drug amount is value. Diluent volume is going to be 100. Drug amount is 80 milligrams. Diluent amount is going to be 100. patient weight is, we go back and we make sure we get the patient weight. The patient's weight is 176 pounds. 26, and then we hit next. Okay. Kilograms, so I have to do the math. It's can I have your calculator? It's gonna be 80 kilograms.
Okay.
Okay, how do I raise that? Okay, it's gonna be 80 kilograms. And then we hit next. Does below guardrail limits. Okay, hit yes. And then value to be infused is gonna be duration is over 1 hour. You make sure that's correct, and you hit start. And it goes back to 100. You clamp. And this running the medication now. You feeling okay?
Yes.
Okay, I'm gonna do some quick documentation. Okay, it's gonna be 18 they piggybacking. Okay, successfully went through. Okay, at this time I'm gonna instruct the patient to call to check for signs of allergies or anything that might cause allergic reaction. So and also I wanna when you have the tubing's only good for 4 days, so you always put down the tubing. You put initials, the date.
Okay.
Make sure you got that in both tubings. Okay, and now we want to instruct the patient that she to look for signs of vertigo. You know, that could be a side effect.
Okay.
Ma'am, I'm gonna put the light over here next to you in case you need us to call for anything. And
Okay.
is anything else we can do for you today?
No, thank you.
Okay. Do you have any more questions for me?
Yes. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes. Also, I wanted to check for the client's Bancotroph. I mean, gentamicin trough. We're
Yeah.
giving gent, which this is the second dose. So if this were to be the second dose, we check the gentamicin trough. If it's the first dose, we don't have to check for that.
Okay.
Okay.
Did this information affect your decision to administer the medication?
Yes, it would, because the trough is checked before the medications are missing, because you don't want the levels in the blood to be too high, otherwise you won't give the medication.
Okay, I see. Did this information affect how you administer the medication?
It did, because at the time I administer medication, you always have to make sure there's no the therapeutic levels are within range, and the patient has no signs of toxicity, or toxicity.
Okay.
Okay.
No more questions?
Okay. All right. Well, thank you very much.
Thank you.
Bye bye.